Dr. Khaled, thank you so much for joining us for today's Q&A, where we are talking about fertility treatment for women with high BMI. And I know it's such a dear topic to Newlife Clinic. Thank you so much for clarifying these questions we have about treatment for women with high BMI.
My pleasure.
I think one of the big questions we have is whether BMI affects fertility.
Yes, there is ample evidence to show that high BMI decreases fertility, and certainly ladies with a higher BMI have worse results with fertility treatment. Yes.
And is there a BMI limit for treatment?
Well, most clinics will put a BMI limit of 35. The main reason for that is twofold, so two prongs. One is pregnancy with a high BMI is associated with a lot of risks, right? Big babies, more likely to have cesarean section, high risk of thrombosis and blood clots, difficult operations, more likely to have cesarean section, more difficult and complicated cesarean sections. So there's also a higher risk to babies. So, high BMI increases all the risks of pregnancy. That's one thing. The other thing is the success rate decreases with increasing BMI. Okay, so therefore you find that, for example, the NHS upper limit for BMI is 30.
Okay.
Private clinics is a bit higher. However, we are faced with a situation where, there might be some discrimination here. And so for those with high BMI who have a spontaneous pregnancy, what do? You have to take care of them, help them deliver a healthy baby. So, although there is an increased risk, right? So why should those who are struggling not be able to have some help?
Yeah.
Right? They are, again,
it's a really challenging question, isn't it?
Yeah, exactly. So that's the issue. Now, for most private clinics, the issue is whether offering treatment in the clinic is safe or not, right? Because obviously most private clinics will not have the same facilities as big hospitals to support these women if something goes wrong. So it's a matter of basically calculating risk and taking what we call a calculated risk, or make sure that we are not exposing these ladies to I would say undue risk. Yeah, but in my view, they have the right, as any other woman, to start a family, and I think it's a basic human right.
And is that weight loss before treatment always necessary or even possible? Because I know women struggle quite a lot, and sometimes they're told to lose weight, but they're not offered support to get there, and it can be quite challenging. So how do you manage that?
Well, now there's two important points here. Now, losing weight, if they can, and we know it's not always easy, decreases the risks associated with pregnancy, but it doesn't increase the chances of conception.
Okay.
Right? So that's where it's a bit complicated, right? But obviously, if they manage to lose weight, it will make their pregnancy much safer if obviously successful and get pregnant.
So that's good. And so there's not really a need to delay treatment because of losing weight, especially if a woman is, let's say, 37, 38, should she delay a year while she's trying to lose weight?
Well, it's a balance to strike, because obviously, the risks of pregnancy can be significant.
Mm-hmm.
Women still die in pregnancy, right? And therefore, if there is a way of losing weight, it is welcome. But at the same time, we have to look at the other aspect of the situation, and that is the time. And we know that as we get older, the reserve decreases, the quality of the eggs deteriorate, and therefore results are worse. So there's two things that we'll be facing there: the advancing age and the effect of the high BMI on results also. So it's a double whammy in terms of results.
And do you think if patients had access, for example, in the clinic to a nutritionist or psychological support or emotional support, even from the nurses, to help them in that journey, would that be beneficial?
Yes, I mean, anything that might help to lose weight, to have the psychological support through the journey, because it's not short, it's a long time usually. It's months rather than weeks or days. So therefore, yes, that in my view, it's important. It helps for those who want to explore those options. Yes, nutritionist, sometimes acupuncturist, other support like reflexologist and that kind of thing. Some people believe in it. It makes them more relaxed. More relaxed means less stress hormone, hopefully less better results. But it's I think having a holistic kind of approach, right, might help some women. It depends. It's up to them basically in terms of choices. But anything that can relax a lady in her journey towards fertility is welcome.
Dr. Khaled, thank you so much for answering our questions about treatment for women with high BMI.
You're welcome. And it was my pleasure to speak to you.